Hey guys, it's Landon and welcome back to the channel. Today's psychology crash course will be on the commonly abused drug benzodiazepines. Now, benzodiazepines were designed for patients going through extreme trauma or with severe PTSD or anxiety. One of the very first benzodiazepines was known as Librium. Now, Librium is still given to patients that are coming off of Xanax and Klonopin and stronger benzos, which we'll get to in a minute. Now, first we'll talk about alprazolam, which is brand name Xanax. This is by far the most destructive if used in the wrong way, but it can also be the most beneficial because not only is it the most potent, it's the most fast acting, and it hits the patient so fast that it provides immediate relief from panic attacks and disorders like that. It is great for anxiety disorders. However, it is very hard to get off of, just like all of these drugs, which I will talk about in a minute. Now, next we have clonazepam, and commonly known as brand name Klonopin. Now, Klonopin, or clonazepam, is a longer acting benzo than Xanax. Xanax's half-life is, I think, somewhere around 7 hours, while Klonopin is up there in 24 to 48 hour half-life. So when you have a half-life in a drug that long, it's far less addictive, far less potential for abuse. However, it's not going to hit the patient near as quick. So Klonopin might not be as good for a patient that has panic disorder as Xanax, whereas Xanax might not be as good for a patient that has OCD as Klonopin. Because these drugs, they're stigmatized all the time for being awful, but I want to come out and say that they can be very beneficial. And it is a very good thing that these drugs do in fact exist, because if they didn't, then we wouldn't have any treatment for trauma besides therapy. Now, the third most common one that I want to mention is ativan. Now, brand name ativan, or drug class name lorazepam, all of these tend to end in a PAM for some reason, is a slightly shorter acting benzo than Klonopin, slightly longer than Xanax. So it's like your little happy medium between Xanax and Klonopin. But I'd put it more in the Xanax category because it's very fast acting and can also be very beneficial for patients suffering from hiatal hernia and panic attacks and stuff like that. But keep in mind, if you do have a hiatal hernia, some benzodiazepines can actually expand your esophagus, making the condition worse. So it's important to consult with your doctor if that is in fact the case. Now, when discussing with your doctor if you should get on a benzodiazepine, it's important to ask not only your doctor but yourself, do I need this? Are my stress levels bad enough that I need to medicate with a strong tranquilizer, or can I deal with this with therapy? Because if you can deal with it with therapy, by all means, deal with it with therapy. Because I've learned through experience and through observations and through getting my bachelor's in psychology that therapy is the best route always. But sometimes drugs are great. Drugs are godsend. I truly think they are. And not just pharmaceuticals, but natural botanicals as well. But, it's just, you have to take the right substances for you, and benzos aren't right for everybody. A lot of people abuse them and drink on them, and the withdrawals off benzos are so vicious. They have actually been claimed to be worse than alcohol withdrawals by several patients that have been in detox, and even people that I've known personally. So when it comes to benzos, just the moral of the story here is be safe. Talk to your doctor if you really think you need one for your anxiety. Don't just go pill peddling to different doctors trying to score some Xanax if you don't truly need it, if it's not your drug, or some Klonopin or one of these other benzos. And aside from that, just be aware that these drugs have severe withdrawals. So if you're planning on taking one of these, just know that when you get off of it, it's going to be absolute hell. But if you have bad trauma, as a side note, if you have bad trauma, then sometimes it's good to stay on a benzodiazepine your whole life. But that's a whole nother video. So thanks for watching, and if you like my psychology videos and my channel, be sure to leave a like and a comment below. and hit that subscribe button. Thanks.